Hi, and welcome to the video course on clinical evaluation. In upcoming videos, I will guide you through understanding the clinical evaluation, how to search for literature, and the connection between clinical evaluation, post-market surveillance, and post-market clinical follow-up. The key information about clinical evaluation can be found in the MDR Article 61 and the Annex 14. These documents and chapters provide details on the content, the plan, the report of clinical evaluation. Additionally, certain MDG documents offer guidance on clinical evaluation in general and specifically for software classified as a medical device. As per MDR, a clinical evaluation refers to a systematic and planned process to continuously generate, collect, analyze, and assess clinical data relevant for the device. The aim is to verify the safety, performance, and clinical benefits of the device when used as intended by the manufacturer. Well, this sounds rather boring, and we'll focus in the later videos on how this actually could look like in practice. To receive the CE mark, one of the requirements is to compile the clinical evaluation report. This report essentially demonstrates that your device is safe to use and performs as intended. It also involves summarizing various reports and tests conducted for the device. For instance, if your device is sterile and comes in contact with body surfaces, you must demonstrate sterility methods and tests, as well as show compatibility with the human tissue. What we can see here in the first slide is basically the pre-marketing phase, where you're conducting all of your preclinical and clinical tests. Based on your intended use statement, you draw up your risk management, you have done usability studies, if applicable, compatibility studies, and of course, if you have an electric device, you also will focus on electrical safety. And the centerpiece of the clinical evaluation report is to demonstrate the clinical evidence. You summarize all of this in the CER. After successfully obtaining the CE mark and launching your device to the market, the clinical evaluation needs regular updates based on your risk class. The MDR does not specify hard timelines for update cycles. For Class 3 and implantable devices, the CER is updated at least annually, and for other devices, updates occur as necessary, typically when you get new information on their safety and performance. What you can see in this slide is the CER, the CEP, after obtaining the CE mark. This clinical evaluation is updated and interconnects with proactive and reactive post-market activities. A proactive activity is the PMCF, the post-market clinical follow-up, which also uses a plan and a PMCF evaluation report. We will dive later deeper into these documents. You basically proactively monitor your device in the market. A more reactive PMS tool or system is the PMS, the post-market surveillance system, where you monitor your device and document the received information. All of these documents and channels of information update your clinical evaluation, and it also interconnects with the risk management and usability. When we take a look into the SOP for the clinical evaluation, you can see that it is very straightforward and rather short. You define your process owner. That could be a clinician and you're working in your team, can also be the PRRC or your quality management officer. The process steps involves the creation of the clinical evaluation plan. You will also need some input documents, such as the intended purpose, the risk management, or tests that you conducted already. And the next step, you will summarize these tests and reports in the clinical evaluation report to demonstrate the safety and performance of your device. In our template for the CER, we also provide you with an input document checklist, so you can just go through it and see what's applicable for you. And as mentioned before, the PMCF activities update your clinical evaluation and your clinical evaluation report. So we also need to take this into consideration. Basically, you can draw up methods. We will take a look into this later on how to identify your device in the market and summarize data from these investigations.